Dr. Kramer, nice to meet you. I'm
Nice to
Reid.
meet you.
Um, did you find the building all right today?
Yeah,
How are you doing this morning?
I'm doing all right.
Good, good. Well, I hope we're not taking too much of your time today. I will try to keep this brief. But the reason you're in here today is to interview Riley, or to talk about Riley Winters and kind of the issues that he's having in his lifetime right now. And so I just want you to be honest with me, and I'll be honest with you, and we'll hopefully find some justice for Riley Winters. All right.
Sounds good.
So it's my understanding that you're a psychiatrist.
Indeed.
Where did you do your studies at? Where was your undergrad and doctorate?
Well, I got my bachelor's degree in 1994 at Western Kentucky University, and then in 1998, I got my master's at Duke University plus my psychiatrist residency at the Duke University Medical Center.
How was the residency at the Duke?
It was
How was
pretty
that?
good.
Was it good?
Yeah.
I hear it's one of the better programs to be at for a psychiatrist.
Oh yeah, for sure. Yeah, and it led to me being board certified in psychiatry and psychology.
What year was that in?
Just a couple years after.
Okay. When did you move back to the Midland Center?
I'd say like right after school.
Right after, and that's when you started working as a psychiatrist.
I started as well, for about 10 years now. I've been doing my medical practice and specializing in people over the age of 40 and how major events in their life affect their mental health. And before that, for 6 years, I was doing I was an on-call psychiatrist for Carucci Medical Medical Hospital.
That's right here in the Midland Center.
That was in New Jersey.
That was in New Jersey.
Yeah, that was in New Jersey.
How come you switched?
Just to
Change the scenery.
Yeah, I wanted to have my own medical practice, do my own thing.
So you mentioned when you got back in the Midland Center, you said you worked with people who are over the age of 40 who've had some some stressful times. Can you explain a little bit on that?
Well, just every person over the age of 40 goes through events in their life that affects their mental health and can cause, anxiety and depression and all those sorts of things. But it's so things like job termination play a role in that significantly, and it's different to being fired than to just having a normal event in your life. Like wrongful termination, something like Riley Winters claiming age discrimination. These can all cause the same things as if like a family member had passed away. All the same type of feelings can occur from also a job termination.
Is that a recent study? I haven't heard.
Well, there's a Gallup poll that says that people who are fired from their jobs, who are unemployed, are more than twice as likely to experience some sort of depression, anxiety disorder. I believe up until the first 27 weeks, it's 12.6% of people who are unemployed experience depression or anxiety compared to 6% of people who are unemployed. And after 27, it jumps to 18%.
Holy cow. So, when was the first day? Now we're kind of jumping into talking actually about Riley Winters. When was the first day you met him?
He was referred to me on January 4th, 2016, and he came to me on January 15th, 2016. That's when I met him.
And how many times have you met with Riley?
4 times.
4 times. Over how long of a time span?
About a year.
A year?
Mm-hmm.
How come the visits are so spaced out?
Just to see the progression of his mental stability and what his anxiety issues. See if it progresses or worsens or gets better.
Can you describe like how he's different, or is his mental issues, has his mental stability gotten worse from visit 1 to visit 4?
Well, the first visit was on January 15th, the day he came to me, and he was experiencing like a state of repression and denial. He was kind of in shock. The second one, he was having more somatic symptoms, irritability, hostility, resentment type stuff like that. And then the third visit was more of severe like mistrust in everyone, paranoia. It got a big sense of victimization that kind of stuck with to the fourth one as well.
Has he been meeting with any other psychiatrists, or it just has been you?
Just me, as I know of.
Just no one. Okay. So with these symptoms, what do they indicate to you?
Um,
Or
um, from what I've seen and what I've studied and researched, and based on my experience, Riley's definitely experiencing going through PTSD, post traumatic stress disorder.
and what is that a disorder of?
Just after a major event of someone's life, um, things like there's four diagnostic clusters that come with PTSD: re-experiencing, mood and arousal, um, also just this sense of victimization, anxiety, depression, stuff like that.
So when you're looking at him through these four visits you had with him, do you run any tests on him? How do you do it? Do you just speak? Do you guys just have conversations, or how do you kind of diagnose what he's going through?
Yeah, we just kind of I talk to him. He experiences what's been going on in his life, what types of mental things have been going
Okay.
on with him. So it's kind of just based on that.
So it's more conversations as opposed to running like mental tests on him and whatnot.
We have done a couple of mental tests. We we did one mental status evaluation. We also did a multiphasic Minnesota multiphasic personality inventory, a Millen clinical multi-taxational inventory, and then a sentence. Um, there's one more, I can't
It's
remember the
okay.
name.
Do all three or four of them kind of generally do the same thing, or what are they testing essentially?
All different, like
Just different parts.
yeah.
Okay. Um, and in your opinion, it's directly PTSD, correct?
Hmm.
And what type of having met Riley Winters, have you prescribed him anything? Have you after that fourth visit? What have you done since?
Um, I haven't prescribed him anything. Just I've diagnosed him with PTSD, and um, I that's basically all I've done.
Okay. Do you guys have plan? Do you have a scheduled for a fifth or a session?
No.
No, not yet this time. Okay. Um. So let's see. We've when was that? When was the fourth meeting you had with him, or that session?
January 6, 2017.
So it's been a full about calendar year since you've met Riley Winters. Okay.
Mm.
And in your opinion, what is he? What are long term effects does Riley face with PTSD?
Just decreased sense of self worth, um, social issues.
Okay.
He says that he doesn't go to any social events anymore. Um, just the long term mental health of the person. Uh, Riley cannot go, has no trust in people who are giving him job offers. So it'd be, I mean, it's gonna take a while for him just to get a job.
And this is all directly related to his termination.
Hmm.
What? How do you have you dealt with clients or patients that have been diagnosed with PTSD?
Um, over time to time, yeah. I've been involved in 20 other cases. 12 were on wrongful termination, and then 5 were on age discrimination.
Okay.
But yeah, all those definitely.
Okay, we'll get back to that in a sec. But so when someone is diagnosed with PTSD, what do you do as their psychiatrist to kind of help kind of help diffuse or help them get back on the right track?
Just talk to them, just kind of go through what they're going through, find out, come up with a plan to what
Okay.
type of steps we can take in order to get them back into that state of mind where they can work again.
And is this a successful treatment typically, or
Usually, yes.
okay? And so a little bit ago you said you have dealt with 12 other wrongful termination suits, and have all 12 of those developed PTSD?
No, not all 12 of them.
Have any?
Couple, yes.
Couple, okay. And then they're suffering from the same symptoms and whatnot as Riley Winters?
Hmm.
Okay, okay. Um, just a few other questions. Um, So with with the cases that you've dealt with that have been diagnosed as PTSD, long term, can you help them get back to where they were before the termination or before the PTSD?
You can. It takes a while, and it's very difficult.
Okay, and that's your honest. That's just the honest answer.
Mhm.
That's not okay. Okay, well, thank you. A few other questions. What do you bill out for?
Well, I charge um, $350 an hour. That's what Riley paid for each visit, and then Riley's also paying me $5,000 for testifying and travel expenses and lodging expenses.
Okay. Is that about you're accustomed to receiving from
Mhm.
other cases? Okay. Um, and finally, I know you were on the topic of your expertise. So is your title just psychiatrist? There's nothing else.
Psychology and psychiatry.
Okay. And your main profession is just working as that. You work with the client or the patient all the way through, right? It's
Hmm.
not just diagnosing them. Okay. Okay. Um, Well, thank you, Dr. Kramer. We have no other questions, and we'll brief you before we go to court on this one. Okay.
Okay, thank you.
Thank you.